Good afternoon. It's already
Good afternoon, Doc.
So we will now start. It's 2 o'clock. Okay. So I'd like to welcome everybody. Okay. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of the companions attending with you so that we'll have a complete attendance. Use the chat box to ask questions and make comments while the pep talk is on. Okay. There'll be group pictures at the start and end of the pep talk. So during the group picture taking, please show your face in the video. As a reminder, please take the online learning cum evaluation test exercise, or OLETE, for mastery of learning and have a perfect score to get a certificate. I have placed the link in the Facebook group. Later on, I'm going to place the link here. Okay. And then I also placed the link already in the Viber group. As a reminder, also 50 OLETE certificates is equivalent to 1 voucher for a free ROJoson telemedical consultations. So let's now have a group picture taking before we start in 2 minutes. Please turn on your video to show your face. There are 2 pages. 2 pages. Ready, ready? Okay. 1, 1, 2, 1, 2. Pahabol. 1, 2. Last call. 1, 2, 3. Page 1. And we'll have page 2. Okay. 1, 2, 3. Okay. Let me save it first. Okay. Okay. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP Talk. I completed the core course on October 9, 2021. This is for just information of the newcomers. Okay. And then from October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in the Development of Breast Cancer. Last time we talked about cancer in general. Today we will focus on breast cancer. Okay, this is part of the cancer course. Okay. The empowerment objective would be for the lay people to have an understanding of the fundamentals and generalities in the development of breast cancer as a health disorder or medical disease. I like to have some definition of terms and then also some rules to delimit the coverage of my talk because I won't be able to tackle everything. Fundamentals means simplest and essential facts and theories which can serve as a basis for or foundation and support for advanced additional information. So we will just tackle the simplest and essential facts. And then generalities, meaning I'll just give general statements of information and not covering the specifics and not too detailed. Okay. So on breast cancer, it's the appearance and growth of breast cancer. So the contents will be the following. What is a breast cancer? How common? What are the different types? What are the possible and theorized causes? Can breast cancer be prevented? Who are at high risk? What are the behaviors of breast cancer? How does a breast cancer kill a patient? And then, is breast cancer curable? So let's start with what is a breast cancer. A breast cancer is a medical disease when some of the breast cells in the breast, grow uncontrollably with a potential to invade the nearby body tissues or organs, and to spread to distant tissues or organs, to far away organs. A breast cancer presents as a solid tumor and not as a liquid tumor like blood cancer. It is also known as breast malignancy or malignant tumor of the breast, to differentiate it from the so-called benign tumor of the breast, which exists and which does not invade and spread. So how common is breast cancer? Breast cancer is the most common cancer in the world and in the Philippines, combining both sexes. Okay, as of 2020, so that's the current data. Okay, it's more common than lung cancer. Okay. It is more common in females than in males. So in males, there could also be breast cancer, but the ratio is 100 to 1, 100 females to 1 male. It is more common in the older than younger females, okay, usually about 40 years old and older. What are the different types of breast cancer? Not all breast cancers are the same. Take note of that. It is important to know the specific type, as this affects decisions on the treatment and also the prognosis. There are so many different ways of describing the types of breast cancer. There may be more than 20 types depending on how the description is done. One classification is primarily based on the origin of the cancer in the specific parts of the breast. Example, it can arise from the lobules, where milk is usually produced, or from the ducts. The ducts are those which carry breast milk from the lobules to the nipple, or the substances or the tissues in between, within the breast, okay, outside the lobules and the ducts. So you have the blood vessels, fat, muscles in the breast, okay, little muscles in the breast. Usually, there's only a few amounts of muscle there, okay. So those arising from the lobules and the ducts are usually adenocarcinoma. Those arising from the connective tissue, okay, blood vessels. Between the two, adenocarcinoma is more common than sarcoma, okay? So the other way of classifying the different types, based on the unique appearance of the cancer cells being seen by the pathologists, okay, they look through the microscope. So they classified it into tubular, mucinous, medullary, papillary. Also based on the specific cells of origin, example, angiosarcoma arises from the lining of blood and lymph vessels, angio. Malignant phylloides tumor arising from the stroma. And then liposarcoma, lipofat, so arising from the fat. Special types of breast cancer can be Paget's disease of the nipple. This is not so common, but it affects the skin of the nipple and areola. So that's usually a cue that you might have a Paget's disease. Inflammatory breast cancer, okay, this is usually due to obstructive cancer cells in the skin's lymph vessels. Based on whether there is invasion or not. So it can be classified as to non-invasive adenocarcinoma or invasive adenocarcinoma. Invasive adenocarcinoma means it has already gone outside the cell. If it's still within the cell, it's non-invasive, and the other term is carcinoma in situ. Based on whether the cancer cells can be fueled by hormones, usually estrogen and progesterone. Okay, so you have such thing as estrogen receptor positive or negative. Okay, cancer with the progesterone receptors positive or negative. This is another way of classifying the breast cancer. Based on the genetic makeup of the cancer cells, whether it contains HER2 gene or other tumor markers. Probably the last, at the moment, that's the last way of classifying different types of cancer. They group information on the cancer cells using the receptor assay information and also the HER2 gene. So at the moment, they came out with 4 categories. Okay, those which have ER positive. ER means estrogen receptor. PR, progesterone receptor assay positive. HER2 negative. ER positive. PR negative. HER2 negative. ER negative. PR negative. HER2 positive. ER negative. ER negative. PR and HER2 negative, the so-called triple negative. Okay. Let's now go to the possible and theorized causes of cancers. Unfortunately, up to now, most of the time, 90 to 95%, nobody knows the exact cause of breast cancer developing in the patient, as most of the time, the cause is multifactorial, different factors, different causes. Okay. So in only 5 to 10% of breast cancers are they due to inherited gene mutation from the parents. So majority are the so-called sporadic, not due to the inherited gene mutations. All diseases, including breast cancers, have underlying antecedent and immediate causes. And they also have predisposing, precipitating, and perpetuating factors. However, it is difficult to pinpoint the exact cause, a single cause at that, and as oftentimes the cause is multifactorial. So at best, we can only theorize the possible causes. We can make an educated guess, if you want, the possible causes and factors. For a patient with a breast cancer, an example of analysis of the causes will be like this. Okay, this is one scenario. Genetic predisposition could be the underlying cause for that particular patient. And then long-term unhealthy lifestyle could be the antecedent, precipitating, or perpetuating factor. If the patient keeps on doing this, practicing unhealthy lifestyle, it could be the perpetuating factor. But the last step is really gene mutation as the immediate cause. Another example, excessive genetic predisposition first as the underlying cause, then excessive exposure to radiation could be the antecedent, precipitating, and perpetuating factor. And then lastly, gene mutation is the immediate cause. Another scenario or situation on a patient could have no genetic predisposition at all, but the underlying cause is there. It may be from chemicals, which now becomes the antecedent cause, precipitating or perpetuating factors. But in the end, it's still the gene mutation, which will be the immediate cause. So at present stage of knowledge, for the sporadic cases, 90 to 95% of cases, and not the inherited gene mutations from the parents, which just comprise about 5 to 10%, it seems that the last ultimate and proximate cause of cancer is mutation to the gene within the cells, okay, within the DNA. Okay, so thus one can say that breast cancer, just like any cancer, is a genetic disease. That is, it is caused by changes to the gene that control the way our cells function, especially on how they grow and divide. There are 3 most common theorized way by which gene mutation can occur. One is there's a gene that allows rapid growth, the so-called oncogene. So usually the gene mutation will tell the cell to grow and divide more rapidly. So if this is present, it can do that. This creates many new cells that all have the same mutation. Another theorized cause is failure to stop uncontrolled cell growth. There's usually the so-called tumor suppressor gene. Okay, normally the cells know when to stop growing so that you just have the right amount of normal cells. Okay. But a mutation in the tumor suppressor gene will allow the cancer cells to continue on growing and accumulating. The other possible cause will be in the gene mutation is that it makes mistake when repairing the DNA. Normally, we have DNA repair genes which look for errors in the cell's DNA and make the necessary correction. But a mutation in the DNA repair gene may mean that other errors cannot be corrected or are not corrected, leading the cells to become cancerous. So what causes the gene mutation? What are the underlying antecedent immediate causes? And then what are the predisposing, precipitating, and perpetuating factors? It can occur in two general instances. You have gene mutations you're born with, meaning you inherit this from your parents, okay? But this type of mutation accounts only for a small percentage of cancers, okay? Of breast cancer also, 5 to 10%. Okay, so this could be the so-called underlying and predisposing cause. The other one are the gene mutations that occur after birth, in which this is the majority of cases. Okay, so most gene mutations occur after you are born, most, and are not inherited. A number of factors that can cause gene mutations after birth would be smoking, radiation, viruses, cancer-causing chemicals, obesity, hormones, chronic inflammation, and the lack of exercise. Okay. So all of this can be the antecedent, precipitating, and perpetuating cause for the gene mutation. So in the end, it's the gene mutations that you are born with, if you have one, and those that you acquire throughout your life that will work together to cause the cancer. So the next issue is, can breast cancer be prevented? Yes, I'll answer it yes, but with a caveat, not all, so not 100% preventable. Okay. Breast cancers develop through multiple factors, as we mentioned earlier: genetic predisposition, environmental factors, including lifestyle, aging, that it is difficult to identify a sure-shot specific strategy of prevention. Okay, that's why it's not 100% preventable. There are some things that can increase the risk of cancer, breast cancer, that we cannot change. Examples would be the damaged DNA that we inherit from a parent, the presence of family history, which again is also genetic, has a genetic background, and then getting older. Okay. So this is just an infographic showing age as risk factors in DNA change, leading to gene mutation and cancer development. Okay. So we usually have more mutations as we grow older. Okay. The other reason why I said that not all cancers are preventable, okay, although there are such things as controllable risk factors such as diet, physical activity, and other lifestyle choices, you can try to control this. Okay, it can lower your chances of developing cancer, but no guarantee. Okay. Best effort at the moment. Okay. Who are at higher risk of developing breast cancer? The exact specific cause of breast cancer developing in the patient is difficult to pinpoint, really. Okay, so for a preventive program against breast cancer, the advice is know the risk factors at best. Okay, know the controllable ones, and then try to control and mitigate them. So risk factors, I have to mention this, that risk factors, if present, affect your chances of getting a breast cancer. But having a risk factor does not mean that you are guaranteed to get it. Okay, it's not automatic, but just still try to avoid the risk factors. Again, to emphasize, managing certain controllable risk factors such as diet, physical activity, which are relatively easy to manage. Okay. Lifestyle choices can lower your chances of developing a breast cancer, but no guarantee also. Okay. So these are the uncontrollable risk factors. You cannot avoid choosing your sex. Okay. So female. You cannot also avoid aging. Okay. Family history of breast cancer. History of breast cancer on one breast, and then inherited breast cancer genes from the parents. So 5 uncontrollable risk factors. Then controllable risk factors, being overweight and obese, lacking adequate amount of exercise, drinking alcohol excessively, using hormonal replacement therapy, smoking tobacco or exposing to tobacco smoke, and then exposing to excessive radiation, particularly to the chest and the breast area. So these are some of the cancer prevention mitigation tips on the controllable risk factors, not on the uncontrollable risk factors. Okay. So number 1, maintain a healthy diet, have adequate amount of exercise, drink alcohol in moderation, limit the use of hormonal replacement therapy, avoid exposure to tobacco smoke, avoid excessive radiation exposure, eat healthy diet, more of plant-based diet, and then lastly, always be in touch with reliable medical information on breast cancer risk and prevention. What are the behaviors of breast cancer is the next topic. Once a breast cancer develops, it has the potential to grow and invade or infiltrate adjacent organs and tissues, and also the potential to spread to distant, faraway sites in the body. The rate of growth and spread of the cancer is dependent primarily on the behavior of the mutated gene, okay, which we cannot predict, and secondarily on the presence of promoting factors in the person's body, like medications and hormonal levels, and in the environment like cancer-causing chemicals. A breast cancer that has spread to another place in the body is called a metastatic cancer, and the process is called metastasis. A metastatic cancer has the same name and the same type of cancer cells as the original or primary cancer. For example, a breast cancer that forms a metastatic tumor in the lungs is metastatic breast cancer and not lung cancer. In addition, if a breast cancer spreads to the bone, it's not called a bone cancer, but it's called a metastatic breast cancer to the bone. The most common regional site, meaning the area in the region, no, not the distant parts, no, will be the armpit lymph nodes. That's the most common. Okay, right and left armpit. Okay, usually, if the right side is involved, usually on the right armpit. Left side is there's a mass there that there's cancer on the left side. Sometimes it crosses to the other side. Okay, the most common distant sites of spread are the bone, the lungs, the brain, and the liver. How does a breast cancer kill a patient? There are usually 2 ways, the direct cause and this indirect cause, primary or secondary. Okay, in the direct cause, okay, breast cancer can directly kill a patient when it invades or it spreads and metastasizes to the essential organs like the bones, the lungs, the liver, and brain, and then stop the all these normal organs to function properly. Indirect cause will be complications during surgery, complications during other treatment like chemotherapy, infection due to compromised immune system, and then malnutrition. There could be other causes. So at the moment, it's the 2 most common leading causes of death for those with breast cancer are these 2, venous thrombosis and pulmonary embolism. Okay? Both of these conditions come from blood clots. Okay? So if you have blood clots, it might get bloods into one of these organs like the brain and lungs, and then when it's the blood, it cuts off the blood flow, and then the results can be deadly. Okay. Is cancer curable? Before I answer this question, because we have to define what's medical cure, okay? Medical cure means it's a medical condition that's completely gone and will never come back. This is the conventional definition. For example, if you have appendicitis, then the doctors remove the appendix, then chances are you will be cured. You won't have appendicitis anymore. If you have gallbladder stones, the doctors remove your gallbladder with the stones, you have been cured of the problem. So this is the conventional definition of medical cure. Okay. Now for breast cancers, we know that there are patients who after treatment do not have their cancers coming back 10, 15, 20, even 30 years or even longer. Okay. Strictly speaking, they can be considered cured because it did not come back. Okay. However, doctors do not want to categorically use the word cure. They just use the word or the phrase in remission. In remission. So doctors can talk of curative goal during treatment, okay, which means trying to eradicate all the cancers completely, okay, with known effective treatment. But at this time, they can only hope that cancers will not recur. They can talk of curative goal during treatment, but in the end, they can just hope that the cancers will not recur. So the end effect of a curative treatment can be cure if no cancer recurs after so many years. Okay? But the doctors will never say or guarantee cure to any cancer after any type of treatment. Now, why doctors do not guarantee cure? Number one reason is we don't know everything about breast cancer as a disease. The best knowledge so far is that there's a gene mutation, and these are the possible theorized causes, which I just discussed. And then the exact mechanism is not yet definitely known. That's why they are trying out targeted cancer therapies at the hormonal, molecular, and gene level. But again, these are not yet 100% successful. The second reason, the usual cancer treatment modalities like surgery, chemotherapy, radiotherapy, the mainstream, the mainline treatment, are strictly speaking not treating the cause because we don't know the exact where the cause really is. Okay, so the surgery just extirpate, the chemotherapy just kill with the drugs, and then the radiotherapy just burn with the cancer. So if the cause is still there, somewhere there, we don't know where it is, there is always the possibility of recurrence after treatment. Okay. Number three reason, no two cancers are the same. So each individual cancer possesses different biologic characteristics. Okay. Even cancers of the same type, same adenocarcinoma, okay, same extent, early stage, localized. Some are slow growing, while some are fast growing. So usually the biologic behavior of the cancer is not known at the time of treatment, but there are really efforts to study to predict the biologic behavior of the cancer. So only time will tell the outcome of the treatment based on the behavior of the cancer. The last reason is that after treatment, we all know this, that some cancer cells may remain somewhere in the body unnoticed, and patients are asymptomatic, no symptoms, no complaints for a long time, even as long as 10 years, 20 years, but can eventually grow, divide, invade, and spread to distant areas and become a nuisance. So when they become a nuisance, this is what we call a recurrence. A recurrence. Complete remission, a term that is usually being used by the doctors instead of cure, means that the test, physical exams, scans show that all signs of your cancer are gone. So some doctors will refer to the complete remission as no evidence of disease, no evidence of recurrence. Okay. So, but we have to remember that complete remission to the doctor's in the doctor's language does not mean cure. Okay. So recurrence, some cancer cells can remain unnoticed in the body for years after treatment. Okay. So if the cancer returns, then it's called a recurrence. The cancer can recur in the same place it was originally diagnosed, example, on the chest, on the breast area, or it can recur in a different part of the body, in the distant area, the lymph nodes, the armpit lymph nodes, the bone, the lungs, etc. So up to now, strictly speaking, there is no true cure for cancer. No guarantee it will not recur. The physician do not talk of cure. They use the word remission if there are no signs of recurrence. But the physicians, together with the patients, always hope for a cure, especially for those cancers which are recognized, diagnosed, and treated early and with known track record of slow growth in behavior. Okay, so these are possible if the cancer are diagnosed early and treated early. There's a good chance for long remission. So to boost the morale of breast cancer patients, though, one may say that the patient is cured already, okay, if there is no recurrence after 10 years or more. But there's always the exception to the rule, okay, the caveat. Okay, it may still recur, small percentage of patient. Okay. So long remission is usually seen in patients who are diagnosed and treated early. So this is the aim of all the treatment in breast cancer: early diagnosis and early treatment. So summary, conclusions, and takeaway. I have tackled all of these topics. What is breast cancer? How common? Different types? Causes? Can they be prevented? Who are at higher risk? Behaviors? How does a breast cancer kill a patient? Is breast cancer curable? A takeaway in relation to patient management: be always in touch with reliable medical information on fundamentals and generalities in breast cancer development. Okay. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, at kapangyarihan to prevent breast cancer, and in case it is not prevented, to gain greater control over problem solving, decision making in the medical management. So with that, I end my pep talk, fundamentals and generalities in breast cancer development. I hope I have empowered you to have an understanding, better understanding of the fundamentals and generalities in the development of breast cancer as a health disorder or medical disease. So before we go to the next portion of the program, which is the QA, question and answer, reminder, please take the online learning kung evaluation test exercise for mastery of learning and have a perfect score to get the certificate. Okay. Then, reminder also, 50 OLETE certificates equivalent to 1 voucher for a free medical consultation, telemedical. Okay, so let's now have a group picture taking before we start the question and answer portion. Okay. Let's have page 1. Okay, ready? 1, 2, 3. Saving. Page 2. 1, 2, 3. Okay. Okay, so the floor is now open for questions, interactions, suggestions, comments, etc., etc. Okay. So any questions? Are there, okay. So we'll have, ready? Are there questions already? Not yet.
Wala pang questions po.
Okay. So while we're waiting for, you can ask your questions by raising your hands. Okay, okay. Chuchi is raising her hands already. Chuchi, unmute yourself.
Yes.
Unmute. Okay.
Unmute na ba?
Yeah.
Unmute.
Okay.
Can you hear me? Okay. You were saying that those in remission, more or less, the cancer cells are hiding. Can they hide? And how long can they hide?
When you say hiding, it's somewhere there.
Oh, cannot see them. I mean,
yeah,
anywhere.
We cannot detect them even with the best diagnostic test. No, we cannot see them. No, okay. So when you say hiding, no, we just use the word hiding. That unnoticed lang. It's there. No, it's not evident. It's not producing any symptoms. It's not showing itself to us. Okay, because probably of the limitation of the diagnostic test. No? All diagnostic tests have limitations. Example, a breast ultrasound can only detect a breast cancer which is 1 centimeter or bigger. If it's less than 1 centimeter, no, it's not very reliable. No? So ganun din sa mga CT scan. No? If it's less than 1 centimeter, no, usually it's hard to, it will be reported as negative. No? Okay, wala, pero it's still there. No? Okay, but we don't really know when it's there or not. Yan ang tanong. That's the problem. No?
Okay. Another, because sometimes when we have a bukol, no?
Yeah. Yes.
During my lifetime, sometimes merong bukol somewhere, but if it's not growing, then it's not cancer. Ganon?
No.
Is that?
Okay. So if it's not, if there's a bukol, you have to diagnose it right away, whether it's cancer or not. No? Okay. So the behavior, the initial behavior, the behavior of a non-cancer and cancer might be the same initially. Now sa umpisa, no? Mabagal, no? Mabagal lumaki, steady lang siya, but the moment that tumor start spreading to the lymph nodes, no? To the distant organs, that differentiate it now from the non-cancer. Okay? So yan, so we distinguish a bukol in terms of benign and malignant, in terms of whether it's invades or it spread. No? So initially, it might be difficult to say which is which just based on the behavior. Okay. So the characteristics of the mass based on physical examination by the doctors plus the signs, no, will give the clue. So I'll give you an example. If I think I've done this before. If there is a breast mass, okay, sabi mo bukol, no? Breast mass. Let's just focus on the breast now. There is a breast mass which has been there for 2 years, no? Okay, and then you have to diagnose it right away, whether it's benign or malignant. You don't wait for it to behave. I mean, to look what will happen to that mass, whether it will grow bigger or not. Okay. So, but at the time of the examination, if the bukol is already cystic, parang may fluid, no, you can already say, oh, it's benign. No? Okay. So, right away, it's benign. No? So, it doesn't go into the behavior of a cancer. But if the mass is solid and then border niya, it's not so well defined because it's infiltrating the surrounding tissues. Now, you can now say that most likely it's cancer. Okay. Or if there is lymph nodes, accompanying lymph nodes on the axilla, then you can say that probable cancer nito. Okay. Higher chance. No. Okay. So you don't wait for the behavior of the cancer to distinguish whether it's benign or malignant. No? Okay. Probably it can be done, but as as a last priority. But you have to do the first priority first. The first priority is to evaluate the mass, now whether it's cancer or not. No? Okay.
Okay, thank
Can
you.
I doon?
Hello. Who else? Who else?
Doc. Question from Evelyn Yu.
Okay.
How about PET scan? Hindi rin accurate? Question mark.
Okay. So remember, okay, the general rule to remember is nothing is perfect in this world. Okay. Nothing is also perfect in medicine. Nothing is perfect in the medical test. Okay. Just like this morning, I just read an article which I posted on my Facebook because I've been telling you, for those who are attending the pep talk, I've been emphasizing that medicine is an inexact science, not perfect. So this morning, I was reading the vaccines against COVID. So they put a statement there. Okay, no vaccine is 100% effective. No? Okay. So just remember that general rule. Nothing is perfect. No? PET scan, kahit na yung pinakamahal, pinakamodern, is not perfect. No? Okay. I hope I answer your question, Evelyn. Thank you for that questions also, because that's the most common perception of, especially, I can say, Filipino population. If they see something being popularized, di ba? Sasabihin ng mga hospital, maganda ito, maganda ito, maganda ito. No? So you tend to kakagat naman kayo, di ba? Okay. So not knowing that there's also a limitation there. No?
Okay.
Any more?
Is it true that cancer likes and eats sweets or sugar?
Again,
Is it true? Hi, Doc. This is from Chris N. Is it true that cancer likes and eats sweets or sugar?
no, no. Okay, that's not true. Sabi natin, the current state of knowledge is still gene mutation. Gene mutation ng ano.
Gene
No?
mutation.
Okay. Yet in the end, that's the end point. No? Gene mutation. How will cancer cause the gene mutation? The sweets, the sugar? I don't know. Okay. Most likely not. No? Okay. So,
Another
but again, as I said, medicine so inexact. We don't know a lot of things. The best approach is to healthy lifestyle. Okay, eat anything. Everything is poisonous to us. Whatever we eat, whatever air we breathe. Now, everything should be controlled. Everything should be done in moderation. Okay, so don't eat too much sweet. Don't eat too much sugar. Okay. So it's not only breast cancer that can be associated with excess this thing, not excess food, no, but also other diseases. Okay, excess sugar, excess sweet, no. Okay, eat in moderation na lang, ha? Okay. Anything else?
Another question from Melly Ngo. Doc, are tumor markers accurate and can be used as basis to detect cancer? Thanks, Doc.
Okay, the same answer that I made for Evelyn, no? Okay, they are not 100% accurate all the time, okay? So that's why we have to know what are the indications, okay? So can it be used as a basis to detect cancer? Okay, so we don't usually use tumor markers as a starter, no, to detect tumor, to detect cancer. No, we use other types of screening test. Example, sa breast, no, you use mammography as a screening if you have to use if you have to screen your breast. Now if you want to screen a liver cancer, then you can use a tumor marker, but usually you can also use the ultrasound as a screening tool for detecting liver cancer. Okay. So, may mga pros and cons, no? You can use it. That's why sabi ko dun sa aking BRCA, benefit risk cost and availability analysis, put there the options, no? Depending on the situation, which one are you after? What specific cancers are you looking at concerned with? Then you put down the list. Is tumor markers the best for this cancer, or is there the ultrasound is better? Okay, mammography is better. All these things, no? Okay. So I'm not saying that there's no place for tumor markers, but at the moment, it's not the first priority. Okay. Any,
There are 3 questions in a row.
okay.
First, from Jeanette Yu, what are the most common cancer causing chemicals that most people are not aware of?
Chemicals. Of course, we're not aware of. Yung mga cigarette, yung mga nicotine, that's also chemicals, di ba? Okay, so we're all aware of that. Okay, so what are the other cancer cause chemicals? At the moment, I cannot really answer your questions. There are a lot, no? Okay. So people are not aware of.
Okay po.
So ngayon, marami dyan may potential. That's why I said everything that we eat, anything that we breathe, no, are potential for causing problems. No? So try to avoid them if you can. No? Okay. So eat in moderation and try to avoid them. No? Okay. Yun na lang ang rules I follow. Kasi mahirap sabihin na very specific, except for the smoking, di ba? Smoking, the nicotine there is causing a lot of problems. Okay. But for the others, chemicals, I cannot really pinpoint one notorious one at the moment. No? Okay.
Okay po.
Hanapin ko Jeanette mamaya.
Next question po from Jackie Tong. Apart from going for a breast ultrasound and mammogram as a regular regimen for women, when we go for regular blood tests, are there any cancer markers we can test for? Example, CA125.
Isa kayo ni Kaputol, Puri-purihan kami.
Pakimute lang po.
Pakimute lang ho.
Ito dito. Ha?
Okay, mute Lenny. Okay, so okay, let me answer it this way, Jackie. Now, okay, there are a lot of tests that you will be hearing, okay, in the literature, in the internet, and especially and also those promoting their businesses. Okay, but we always go by the guidelines, no, based on evidences. Okay. So if you're going to screen for breast cancer at the moment, now, okay, aside from the breast self-examination as part of the screening for breast cancer, and also the physician examination is also another tool of screening. And then in terms of gadgets, no, at the moment, what is recommended is mammography only, no, mammography, no, okay, because there are evidences that shows that it has improved the survival of patients with cancer. No, but tumor markers are not being used. No, okay, are not being used. But of course, you can hear a lot of hospitals, clinics now promoting that. No, okay, CA125, because the reason why they're not promoting that, because they're most of the time you won't be able to detect the breast cancer using the tumor markers, especially in its early stage. No? Okay. Kaya hindi siya sinasuggest. No? Okay. Okay.
Okay po. Next question from Evelyn Yu. If radiation can cause breast cancer, is it not safe to have annual chest X-ray for annual PE? How about dental X-rays? Does MRI produce radiation?
Okay. So theoretically, as I said, theoretically, all of these are carcinogens, no? Cancer-causing X-ray, no? During annual chest X-ray, dental X-ray, CT scan, okay, mammography, okay? Kaya may maraming issues yan, discussions, no? But we always, the thing to go by is we try to balance the benefit and the risk, the benefit and the risk of doing it, no? Suppose you really need a chest X-ray, although there is a risk, but you need it, so you have to go for it. No, okay. So the risk is there, as I said kanina. I have a slide kanina. Even though you have a risk, it doesn't mean that you're going to have it. Diba? Okay. It might be in the low dose range that it's not really causing problem. Parang pag kumakain tayong, let's say, something, yung mga pagkain, pag sumobra, no? So, mahirap na i-control. But if you eat a little, kahit na poisonous siya, it will be metabolized. It will just disappear. Di ba? Okay, it will be resolved. No? So, in dental X-ray, annual chest X-ray, usually, even mammography, they say that low dose lang naman yan eh. Low dose lang. So, no problem. No? Okay. But theoretically, it's possible that you can have especially yung mga patients with genetic predisposition to develop cancer caused by radiation. As I said, people are different. May mga tao na konting X-ray lang, baka cancer na. Okay? Okay. But majority do not develop into, do not have this problem of cancer coming out because of X-ray. No? But if you keep on repeating the X-rays, okay, then you may get into trouble. Okay. Okay. Just to extend my answer to this question, Evelyn, I'll be talking on thyroid cancer after this session. No, we still have 2 sessions for breast cancer, but after the breast, we'll be talking on thyroid. No, so the risk factors for thyroid cancer is radiation to the neck. Okay, so in the past, that's the most common risk factors for thyroid cancer, radiation to the neck. Okay, so in the past, radiation has been used to treat tonsillitis, to treat acne, yung mga pimples, di ba? In the past yon. Okay, so it has been shown that it can produce a lot of cancer on the thyroid. Na, kaya hindi na masyadong ginagawa yon. Na, okay. Does MRI produce radiation? Usually hindi. They use magnetic resonance. No? Okay. Usually hindi. It's CT scan ang meron. No? Okay. Okay.
Okay. Another question po from Belet del Rosario. Doc, can radiation from television and mobile phones cause cancer?
Okay. Possible. Kaya i-avoid lang natin, ha? Okay? So yung mga sinasabi na charging, when you charge your mobile phone, huwag masyadong malapit sa iyo sa gabi, na ilayo ninyo, okay? Then yung mga tawag doon, oven, what do you call that? What do you call that when you cook, oven, o yung forget the name. Yung quick heating. Quick heating.
Microwave.
Microwave, di ba? Okay. So maraming yan, may maraming possibilities. So try to avoid as much as possible. Okay.
Okay. Another. This is a comment from Maria pusta pulutan. Some chemicals linked to cancer are talc, that is the main ingredient in talcum powder, and asbestos that used to be found in ceiling materials.
Yeah, asbestos, tama, asbestos. No? Okay. Marami. No? Okay, thank you for that. No? Okay. So, try to avoid.
Doc, yun pong kanina yung is ductal carcinoma the same as, yung meron kayong sinabing adenocarcinoma. Pareho ba yun?
Ductal and lobular carcinoma are usually, okay. Yung ductal cells saka lobular cells are, what do you call that? We call that epithelial cells, no? Gland cells, glands, no? Gland, not lining, not connective tissue, no? So gland cells of the gland, no? Ganon, secreting something, or epithelial for the tube, yung lobules, yung isa lobules is a duct, di ba? Yung duct parang isang tube lang siya, di ba? So lining yon, no? So it's not the what we call connective tissue, no? So ang lumalabas doon, it's a carcinoma, no? Okay, not
Yes,
sarcoma, no? And then if if it arises from the lobules or from the duct, lobules, those producing milk, di ba? So, pinaka part of the breast producing milk, the ducts are the one which channel the milk from the lobules to the outside, di ba? Okay. So these are the cells there are the so-called epithelial cells, no? Okay. And then, so the cancer arising from there is what we call adenocarcinoma. Adenocarcinoma.
Adeno. Okay,
Sometimes
Doc.
it can be squamous, no? But the most common is adenocarcinoma. And then those arising from the connective tissue, yung mga in between the lobules, in between lobules and the ducts, you have the blood vessels, you have the yung mga fats, you have the nerves, no? You know, ang tawag doon, cancer arising from there are usually called sarcomas. Sarcomas ang tawag doon. No? Okay. Did
Thank
I
you,
answer
Doc.
your question?
Opo, Doc.
Technical
Yes,
lang.
Doc. Yes, Doc. Doc, other question. Paano niyo po malalaman na nag-recur ang, kasi sabi niyo kanina, pwedeng mag-recur sa breast and to other parts of the organs or body. So, syempre, kaming on remission, we are on the guard din. Pero paano po namin malalaman kung nagre-recur, kung may recurrence?
Okay. So we're now talking about surveillance, di ba? And, di ba? We have, of course, general, yung last time cancer, di ba? We talk about surveillance, na? Surveillance for recurrence, na? So you can do surveillance based on symptom, sign, directed.
Pareho. Okay.
Or
Okay
you
po.
can use the battery of tests if you want.
Opo.
Screening test, na? Okay. So same principles, na? For the breast. Because
Okay.
last time I started with the cancer in general, di ba? I used the basic principles that will be used for all types of cancer, di ba? Okay. So next week, surveillance will be under next week, di ba? Okay. Medical management of breast cancer. Probably I'll be talking about it also. No? Surveillance of breast cancer in terms of recurrence. No? So symptom-based, kung anong nararamdaman mo. No? Okay. So basically, for those who have been attending my telemedical conference, I usually ask them 5 questions. Based on symptoms, meron ka bang cough for long period of time, let's say 1 month? No? So if you have cough, you start suspecting spread to the lungs. Okay. Now, if you have headache for 1 month or more, hindi nawawala, you suspect brain metastasis. Then if you have bone pain for a long time, not the arthritis, then you suspect bone metastasis to the bone. Then if you have pain on the right abdomen, upper abdomen, you suspect liver metastasis. These are the most, di ba, sabi ko, these are the most common site of distant spread. No? Bone, lungs, brain, and liver. No? Ganon. Then the other thing that you ask for, are there bukol nakakapanyo elsewhere? Okay. Aside from the chest area, sa breast area, are there bukol that you are able to feel outside the breast area? If there's some bukol, it could also be a cue for possible breast cancer. Okay. So kung during the examination, the answer is no, and then during the examination, the doctors do not find any mass, anything unusual, then that means you don't have any clinical evidence of recurrence. No. Okay. Did I answer your questions?
Thank you. Yes, Doc. Kung halimbawa po sa ano naman, sa ears, walang ano yun. Parang, opo, parang may pressure sa ears, tapos sumasakit ang ulo. Is that a sign? Kaya,
You have to investigate first kasi medyo malayo, but investigate first baka there's a primary problem on the ear, but not related to the brain tumor. No? Okay.
yes, Doc. Okay. Thank you. Thank you.
Okay. Okay. Any more?
There are more, another question ho sa chat box from Maria Justa Pulutan. Modern LED and LCD TV screens no longer emit radiation. The old cathode television sets gave off a small amount of radiation. Parang comment lang po. Then from Alice Coronel, is long years of breastfeeding can lead also to aggregate breast cancer?
Breastfeeding,
Long years of breastfeeding.
No, it has not been shown to cause breast cancer with breastfeeding. No, okay. It has not been shown. No, okay. So thank you for those comments that you mentioned, Maria Justa. Okay, so kasi ako minimalist lang ako, simple tao lang ako. I don't know those details. No? Okay, but I just look at it this way. Everything is possible carcinogens. No? Okay, so just avoid excessive use, excessive exposure. No? Okay, but thank you for that information. Modern LED, LCD TV seems no longer emit radiations. No? Okay, so let's wait for another few years. Baka may bago na naman sasabihin. May magsasabi, ay, it emits, it causes cancer. Okay. Okay. So in the end, we just have to do everything in moderation. No? Be vigilant na lang. No? Okay. So it's, wala na, it's 3:04. Okay. So before we, okay. So what I want to really ask you is, okay, applying what we learned today. No? So number one, what is breast cancer? No questions about it. No? Okay, everybody knows that. Okay, what is, kasi ilan lang lalaki rito? Isa lang yata, dalawa. No? Okay, the rest are females. So all of you have breasts, so you know where your breast is. Okay, so breast cancer. Number two, how common? Okay, it's very common in the Philippines, but I cannot really say kung natamaan kayo o hindi. No? Okay. Number three, what's the number three questions? The types. Okay. So, okay. How many? Okay. Quick lang nito. Quick. I don't like to offend anybody. No? This is just to correlate my my lecture. Can you, those who are not shy, can you just raise your hands? How many have breast cancer, history of breast cancer? How many have history of breast cancer? Ladies, can you count? Beth, can you count?
1, 2, 3, 4, 5, 6, Ay, yung iba ho, hindi naka-ano naka-video. 6 lang ang nabilang ko.
Okay. So, at least may 6, di ba? Okay.
It's
So, number
9.
9. Okay, okay lang. I won't go into the nitty-gritty part. Number 2, okay, what is the type of cancer that you have? Okay, we talk about different types, di ba? Okay. So, can you just type it on the chat box? Tingnan natin kung anong pinaka-majority. Can you remember your breast cancer? What is it? Sarcoma, adenocarcinoma, invasive ductal carcinoma? Ayan. Application na. Practicum na ito ngayon. Okay. One answer, invasive ductal carcinoma, invasive ductal carcinoma. Okay, dalawa na. Ano pa? Adenocarcinoma. Okay. Tatlo na. Who else? Medullary carcinoma. Wow, okay. Medullary. Okay. Nakita niyo, medullary is one special one. Adenocarcinoma, invasive ductal, background of okay, I'll stop there. Okay, but you can see that you have to remember the type of your breast cancer. Okay, majority are adenocarcinoma rather than sarcoma. Okay, number 2, yung mga sarcoma, angiosarcoma, usually hindi tumatagal yon. But yung mga phylloides, malignant phylloides tumor, Paget's disease, medyo good prognosis yon. Okay. Pero majority, 90% are adenocarcinoma. Okay. And then, the most common still invasive ductal carcinoma instead of invasive lobular carcinoma. Okay. Yan ang pinaka-common. Invasive ductal carcinoma. You have a special type like isa dyan, medullary carcinoma, tubular carcinoma. Usually good prognosis din yon. Good prognosis. Tubular, papillary, medullary. Usually good prognosis. Okay? So let's now go to the, how many are ER? We talk about ER, PR negative, right? Are you aware of your status, ER, PR? Sige. Tatandaan ninyo, ha? You go back to that your records, no? Okay, look at your PR, ER status, okay? So in general, I'll jump the gun on for next kasi I think I'll discuss this next time. Pero ER, PR positive, good prognosis, okay? Compared to ER, PR negative, no? Magandang prognosis, mas maganda. Okay, no, pero no guarantee, no? HER2 new, HER2 positive, pangit, no? Okay? Mas pangit, no? Okay? So that's why yung ER/PR kung positive, they give you hormonal therapy. Okay? Now for the HER2 new, they give you trastuzumab, no? which costs ₱1 million, no? Mahal yun, no? Okay? Then triple negative ER/PR saka HER2 new negative, triple negative, pangit din ang prognosis. That's why they have to undergo chemotherapy. Okay? ER/PR, HER2 positive. Okay. And then, so all of you, okay, in terms of risk factors, have you identified your risk factors? Mahirap, no? Na-identify nyo what led you, what caused your breast cancer? Meron? Who will venture to say that I have identified the cause of my breast cancer? So okay, Tucci.
It's mine is in the family history.
Family
It's-
history. Okay.
Uh-uh.
So, but not the gene, the inherited gene. Na? Okay. Iba yun, ha? Family history. Okay. So even that family history does not mean that if you have a family history of breast cancer, does not always mean that you will have breast cancer. Na?
But you know, there are, I don't know how many cousins, first cousins of mine, because I think it started from my grandmother, who had breast cancer and she died of breast cancer. But the second generation, her children did not have. It's the
Yeah.
third generation that all of us, all the children in the third generation had. In
Oh.
my case, I had it twice. After 36 or 37 years. So very strong yung history.
Okay, yeah, okay. Okay, so family history, kasi maraming variation in family history in terms of intensity, no? Okay, number one, if you have one family member who has breast cancer, medyo merong risk factor, may risk, no? Pero mas mahina compared to, let's say, one mother, one sister who had breast cancer, then most likely higher ang risk mo, no? Okay. So in terms of generation also, kung maraming every generations meron, edi mas mataas, no? Okay. But the exact cause, the exact prediction whether one will have breast cancer, even despite the family history, it's not absolutely certain, no? Okay. So in the end, just hope for the best, no? And be on the lookout. No? Nobody can predict. No? Okay. So genetic families. How about other causes? Have you identified obesity? Malakas kayo kumain? Okay. Sinisisi niyo sarili ninyo? Malakas kayo kumain? Malakas kayo uminom? Okay. 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 So in terms of all of you, I think majority of you have 10, marami dito ay nakikita ko mga 5 years at least, di ba? Marami dyan, no? Okay. So that's a good prognosis, no? Okay. Any more questions before we call it a day?
The rights, meron pa.
Wala na. Let me ay.
Okay, let's call it a day. So if we have additional questions, you just ask me through the Facebook or through the Viber. No? Okay. So it's 3:14. So next Saturday, we will have breast cancer again, but this time medical management. No? Ngayon it's the breast cancer development. No? Next time it will be breast cancer medical management from the physician's point of view. So again, I will divide it into two parts kasi mahaba eh. Diba? Okay. So first part 1 and part 2. No? Okay.